Tryptophan has been shown to help to alleviate anxiety, depression, ADHD, seasonal affective disorder, obsessive-compulsive disorder, PMS, memory loss, and pain. Tryptophan is the sole precursor of serotonin. L-tryptophan's role in brain serotonin synthesis is critical for mood, behavior, and cognition. Serotonin is often referred to as the happiness molecule. Low serotonin levels can result in pain, insomnia, depression, seasonal affective disorder, and chronic fatigue. For your body to manufacture serotonin, it needs an adequate supply of the natural amino acid tryptophan. As a nootropic supplement, tryptophan is used for anxiety, ADHD, depression, insomnia, memory loss, pain, and eating disorders. A lack of bioavailable tryptophan in your body can have a big impact on your life. Tryptophan is an essential amino acid needed to synthesize serotonin, and this plays a role in mood, sleep, learning, and even appetite control. Low levels of tryptophan and serotonin imbalances in the brain are associated with ADHD. Studies have found that children with ADHD have 50% lower than average levels of tryptophan. Low levels of tryptophan can result in short and long-term memory loss. Supplementing with tryptophan has been found to improve memory in healthy adults. Tryptophan is an essential amino acid and a precursor to serotonin, melatonin, and niacin. The enzyme tryptophan hydroxylase converts tryptophan into 5-hydroxytryptophan, or 5-HTP. The decarboxylation of the 5-HTP to serotonin is dependent on the presence of vitamin B6. To further the conversion of serotonin intake into melatonin, it requires the presence of SAMe, S-adenosyl L-methionine. Tryptophan is found in foods like oats, bananas, dried prunes, milk, tuna, cheese, bread, chicken, turkey, and peanuts. Eating food containing tryptophan will increase the levels of this amino acid in your body, but not necessarily boost serotonin levels in your brain. Tryptophan is one of 8 essential amino acids, and it has the lowest concentration in the body of all the amino acids. Tryptophan requires and it competes for active transport into the brain, and it competes for the same receptors as other amino acids. Research has also found that serotonin levels are enhanced by carbohydrates in your meal because insulin release accelerates the serum removal of some of the amino acids that tryptophan is competing with. If your meal has a higher percentage of protein, it also slows the serotonin elevation in the brain. Since tryptophan from food has issues working its way to your brain to make serotonin, why not skip that step and supplement with 5-HTP instead? Tryptophan and 5-HTP both penetrate the blood-brain barrier, and 5-HTP is the intermediate step in serotonin synthesis. L-tryptophan increases serotonin. Tryptophan's main nootropic mechanism of action is as a precursor to the neurotransmitter serotonin. Other neurotransmitters such as melatonin and beta-endorphin increase following tryptophan supplementation. Research shows that tryptophan and serotonin play a significant role in memory. Enhanced brain serotonin has been shown to improve cognitive performance in animals and humans, and decreasing levels of serotonin through tryptophan depletion impairs cognition. A study done in Pakistan assessed memory in rats following tryptophan administration. The rats received tryptophan doses of 50 to 100 milligrams per kg of body weight for 6 weeks. The study showed significant improvements in memory of the rats following the doses of tryptophan. As a precursor to serotonin, tryptophan can have a significant effect on mood. Supplementing with tryptophan has been found to increase not only serotonin, but growth hormone and prolactin also. Researchers infused 11 healthy male subjects with doses of 5, 7.5, and 10 grams of tryptophan, and they monitored their hormonal and behavioral responses. Tryptophan produced significant effects on mental and physical sedation, but it did not increase levels of tranquilization. Tryptophan provided a calming effect without knocking these guys out, even at high doses. As we get older, our brain chemistry and our energy metabolism changes. Tryptophan levels decline. Tryptophan hydroxylase declines. Stress and insulin resistance increase. Magnesium and B6 levels decline. Neurotransmitters decline. Concentration, working memory, and executive function decline. And appetite regulation, energy, and alertness also declines. All of these changes can happen at any age, and they're influenced by declining tryptophan levels. Very little dietary tryptophan is available for protein and serotonin synthesis, and for many people this can be a problem. Anxiety, depression, ADHD, memory loss, binge eating, and a host of other mental and physical issues have been correlated with low tryptophan. Just living in our modern society seems to leave us irritable, stressed out, and anxious. Worst case is problems sleeping, depression, aggressive behavior, reduced motivation, pain, and even suicidal thinking. And all this has been traced to not having enough serotonin in our brain. Serotonin, the happiness molecule, relies on an adequate supply of tryptophan for synthesis. Researchers now recognize that the role that serotonin plays in psychiatric and behavior disturbances comes from tryptophan depletion. Tryptophan hydroxylase is the rate-limiting enzyme needed for serotonin production, and it's involved in the conversion of tryptophan to 5-HTP, which is needed to make serotonin. This enzyme, tryptophan hydroxylase, can be inhibited by stress, insulin resistance, magnesium, or vitamin B6 deficiency, or increasing age. Tryptophan and 5-HTP can penetrate the blood-brain barrier, but tryptophan requires active transport and it competes for the same receptors with other amino acids, including tyrosine, phenylalanine, valine, leucine, and isoleucine. To complicate things even more, serotonin levels are enhanced by carbohydrates in our diet, because insulin release accelerates serum removal of the amino acids that are competing for tryptophan transport, and high levels of protein in our diet slows an increase in serotonin. Many try L-tryptophan for the first time to cure insomnia or as an alternative to prescription sleep medication. Dosing L-tryptophan in the evening will typically ensure that you feel great the next day. You should have more energy for working out. Anxiety levels should decrease. Happiness should increase. Tryptophan could help with memory. Music will sound better. Feelings of self-esteem can improve. Some users report being able to taper off prescription antidepressant drugs by supplementing with L-tryptophan. 5-HTP and tryptophan are natural alternatives for the treatment of depression, and they're often used as alternatives to prescription antidepressant treatments because they don't come with the side effects that are associated with antidepressant drugs. Much of the research looks at finding out if low levels of tryptophan are associated with depression and poor cognition, but there's very little clinical evidence that supplementing with tryptophan will help to reverse low tryptophan levels, and if adding this supplement to your diet will boost the mood or cognition at all. Researchers at the University of Queensland in Australia decided to comb through the research to find out if clinical trials supporting the natural health claims of using 5-HTP or tryptophan for depression had any evidence. The team located 108 trials, of which only 2 studies involving a total of 64 people had the sufficient data to qualify. The team concluded that the very limited data did show that 5-HTP and tryptophan was better than a placebo for alleviating depression. 20 patients in remission or partial remission from depression were studied in a double-blind crossover design trial. Tryptophan was artificially depleted in these patients so scientists could look at the effect on cognition and mood. The research team found what we see in real life. Lower levels of tryptophan had a negative effect on mood, their ability to process positive information, and attention. Serotonin has been recognized as the neurotransmitter that's key to managing depression for the last 30 years. Most of the prescription drug therapies for depression work by raising serotonin levels at the relevant synapses. We also know that tryptophan is the intermediate precursor to serotonin in the brain. So researchers using a what came first, the chicken or the egg approach, decided to find out if low serotonin levels or low tryptophan levels were to blame for the depression symptoms. The researchers in China analyzed the levels of tyrosine, tryptophan, and serotonin in patients with major depressive disorder, and they found that all three were decreased in depressed patients. You should note tyrosine is a precursor to dopamine in the brain. The Centre for Addiction and Health in Toronto conducted a randomized, double-blind, placebo-controlled trial with 30 depressed individuals. The treatment was fluoxetine, which is Prozac, at 20 milligrams per day, 2 grams of tryptophan per day, or placebo for 8 weeks. Mood was assessed using the Hamilton Depression Rating Scale and the Beck's Depression Index during the trial. During the first week, there was a significant decrease in depression in those who used fluoxetine or tryptophan. At 4 weeks, the research team recorded a disruption in sleep patterns for those who were using the Prozac or placebo, but not for the tryptophan group. The team concluded that combining the Prozac with 2 grams of tryptophan was a safe protocol for treating depression. Patients experienced a rapid decrease in depressive symptoms, and the combination had a protective effect on sleep patterns. You should not try this at home. Trials combining tryptophan with SSRIs, SNRIs, and MAOIs are all done under professional supervision. Remember, tryptophan is a precursor to serotonin. An antidepressant medication can also boost serotonin in the brain. When these can be combined, serotonin can be boosted too high. If you increase serotonin too much, you put yourself in real danger of serotonin syndrome, which can lead to all kinds of nasty side effects, even death. Do not combine tryptophan with antidepressants unless you're under supervision of a doctor. Ever wonder why you cut a workout session short, even though physical fatigue wasn't an issue? Researchers found it could be due to a low tryptophan level and its effects on serotonin in your brain. 20 healthy young men aged 21 years used a cycle ergometer at about 50% of their physical capacity for 10 minutes, followed by maximum intensity exercise for another 30 minutes. This sequence was repeated 3 times, and after the 4th series, each participant continued to the highest speed that they could sustain for 20 minutes. The protocol was performed twice, once with and once without tryptophan. Researchers found peak power output during the last 20 minutes was higher on trials performed with tryptophan than on those performed on a placebo. Another trial in Spain recruited 12 healthy sportspeople who ran on a treadmill until exhaustion, once while supplementing with tryptophan and once with a placebo. Total exercise time, perceived exertion rate, maximum heart rate, peak oxygen consumption, pulse recovery, and excess post-exercise oxygen consumption were determined during the 2 trials. Total exercise time was nearly 50% greater after receiving the tryptophan than after receiving a placebo. Perceived exertion rate was lower when using tryptophan. The researchers concluded that the longer exercise time could be due to increased pain tolerance as a result of the tryptophan supplementation. Seasonal affective disorder is a form of depression. It's experienced mainly during the winter. Symptoms include difficulty walking, decreased energy, weight gain, carbohydrate craving, difficulty concentrating, decreased libido, withdrawal, anxiety, depression, and irritability. The first order of treatment is often light therapy, but many do not respond to light therapy, typically because of a mutation in the melanospin gene that's associated with the signaling pathway between the retina and the pineal gland. The pineal gland in your brain is your source of melatonin, and this influences your sleep cycle. Melatonin is synthesized from serotonin, which is synthesized from tryptophan. So if light therapy doesn't work, possibly supplementing with tryptophan to stimulate the production of serotonin and melatonin could be effective. Researchers at the University of British Columbia in Vancouver, Canada, set out to find if tryptophan could help these with seasonal affective disorder where the light therapy had failed. Patients were treated for 2 weeks using light therapy. Those who didn't respond to the light therapy were treated with 1 gram of tryptophan 3 times per day for 2 weeks while continuing the light therapy. The addition of tryptophan resulted in a significant reduction in depression. 64% of the patients in the study showed very good clinical responses to the combined treatment with minimal side effects. The recommended dose of tryptophan is 500 to 1000 milligrams per day for cognitive benefits. The University of Michigan Health Department recommends much higher doses. For lowering appetite and cravings, 0.5 to 2 grams per day. For depression and anxiety, 2 to 6 grams per day. For chronic pain or migraines, 2 to 4 grams per day in divided doses. And for sleep disorders or insomnia, 1 to 2 grams at bedtime. Tryptophan is the precursor to the neurotransmitter serotonin in the brain. Tryptophan hydroxylase is the rate-limiting enzyme that's needed for serotonin production, and it requires magnesium and vitamin B6 to synthesize the serotonin. Tryptophan is also a precursor to the synthesis of vitamin B3 or niacin. So if you don't have enough niacin in your body, supplementing with L-tryptophan will not efficiently produce serotonin because it's being used to produce niacin. This also depletes stores of the vitamin cofactors B1, B2, and B6. So supplement with L-tryptophan and a B vitamin complex that also includes B3, B6, and magnesium. Some clinical trials used much higher doses of tryptophan, and this is not recommended without supervision. Too much tryptophan can make you sleepy, and it could produce excess levels of 5-HTP and serotonin, which could lead to serotonin syndrome. Tryptophan is a normal part of your diet and is considered non-toxic and safe at recommended doses. In the unlikely event that you already have adequate levels of tryptophan in your body, supplementing with more could cause problems. Tryptophan could cause stomach upset, loss of appetite, nausea, heartburn, drowsiness, headaches, dry mouth, and sexual problems. Start at the lowest dose possible to see how your body reacts. When you first start with L-tryptophan, take your dose in the evening to avoid any possible drowsiness. Low to moderate doses of tryptophan, 30 milligrams per pound of body weight, or about 4.5 grams for the average 165-pound adult, is considered safe and free of side effects. However, most don't need to dose anywhere near those levels. Do not use L-tryptophan if you're taking antidepressant medications like SSRIs without a doctor's supervision. Too much tryptophan in combination with these drugs can produce a serotonin syndrome. This can lead to delirium, involuntary muscle contractions, high fever, and coma, and in the worst case, death. Your body does get some tryptophan from the food that you eat, but this amino acid is competing with other amino acids for transport to your brain. It's competing for the same receptors as carbohydrates and proteins in your meal, and this can affect tryptophan's ability to synthesize serotonin in your brain. Supplementing with tryptophan will make more of this amino acid available to then synthesize serotonin and melatonin. Tryptophan is especially helpful for people with low serotonin levels. Boosting this crucial neurotransmitter can then help to alleviate insomnia, pain, depression, and anxiety. 500 milligrams of L-tryptophan per day and take it in the evenings. See how your body reacts and how you feel the next day. Increase the dose to no more than 2 grams per day as needed and watch for side effects. L-tryptophan requires adequate levels of B3, B6, and magnesium for serotonin synthesis, so add a good B6 complex vitamin and a magnesium to your diet when taking L-tryptophan.